Starting. Okay, awesome. Good morning, everyone. Thank you for joining our monthly MARG meeting, the Multidisciplinary Advocates and Researchers Group. I'm so excited today that we have some presenters, but I will do a couple of quick announcements before. And Alan, please feel free to interrupt me. I know I have them right in front of me, but there are things that sometimes I forget that are important to the group as well. So as you have all been aware, we have been working on our community advisory board rebranding. So we are about to officially start recruiting in the month of February. You will receive a flyer with a QR code and some details, a link. The QR code will link to our red cap form. Anyone that you think would be interested, whether they have experience in research or not, please send it and distribute it widely among your audiences. I'm looking for we are looking for a variety of people. So unlike our community advisory board from the past, this one I'd like to be a super cab, putting that in quotes, where because we have all these partner institutions that make up Frontiers, we would like for there to be representation from all the institutions, and that we don't have a monthly meeting where everyone attends, but we have subcommittees of people. So if there are people that want to participate in letting investigators know how to increase their recruitment, how to make recruitment better. It's essentially, it would be like a rapid reactor panel. Then those would be people that would solely do that. If there are people that want to chime in on how we do our operations and procedures, they would attend the Frontiers Operations Group, which consists of all of our partner institutions representatives. Their core leads and navigators are all in that room, so they can be a part of that. If there are people that simply want to do community, they're the people that link us to all the events that are going on in the community. There's a subcommittee for that. So that's the goal for what this community advisory board would look like and what it would be. Alan, am I forgetting anything from some of the goals that we talked about for this group?
I don't think so. Just, we're just looking for super diverse group of folks that again may or may not have experience. So would love to just have a really wide range of people involved.
Yeah. I think that's the key. In the past, I believe there's been more of a pointed search for people that already had experience. And we will have some people with experience with the world of research, but we want to expand that and make sure that we keep this alive. So we've had one PI that was a community member. His name was Broderick Crawford. And we don't want him to be the only community member that is a PI or a co-PI on a project with Frontier. So I'll get off my soapbox about the CAB recruitment, but you will receive a flyer. Please distribute it widely. Um, for those of you who are looking forward to our meet and greet for February, we have decided to cancel it. It is President's Day. I did not realize that when I said it. So as mentioned, for some of you who were on the call earlier, a lot of the public schools are closed on Monday. So a lot of us will be doing caregiving that day and may not be able to navigate that, getting out to the meet and greet. So we've had some low attendance and a lot of people saying they can't attend. So we will be canceling. You will receive a cancellation during this meeting, most likely. And the third update that I have is regarding our MARG bulletin. So some of you have sent me events and other information that you wanted to be distributed among this group. And I was sending out a weekly MARG bulletin that stopped at the beginning of December because I was trying to learn a new platform called Emma. It's like Constant Contact. And I'm pretty good with things like this. I have created a website before, but for some reason, Emma is giving me a lot of trouble. So I wanted to let you know the MARG bulletins will be back up and running soon. You'll be receiving them again through this platform. It'll actually come from me, but it'll look a little cleaner. It won't actually look like a bulletin board, a messy bulletin board in a community center. It'll have a cleaner, slicker feel to it. So those will resume soon. My apologies if there were things you wanted to get out to the group and they were not distributed. That was my own user error in that way. Um,
Hope, did you have a question?
I think you're
I
still muted.
did. It was just related to the community advisory board. Will the flyer kind of describe for us like what we're asking of them and what they'll get from participating? Like, kind of the give and get sort of description.
Yes, it includes a payment structure as well as what the expectations are. I also plan to attach to the Red Cap form our charter, which includes what we've created and what we hope to be revamped with a new cab. If there are things that we forgot or we're missing, we're hoping that they can chime in and let us know. And it's open to be edited and changed. So both the charter will be attached to the Red Cap and the description will be on the flyer.
I'm super excited at seeing that, and thank you for pulling that together. I'm going to compare it to ours, and then if there's anything that I think we need for the Cancer Center, I'll let you know and say, can we add this into ours too? So,
and vice versa. Like, have you
Okay.
thought about adding this? This is what we use for
Okay.
Pivot. Please.
All right. Thank you.
Thank you, Hope.
One other question, along with Hope's question. So who will be the Frontiers like coordinator or leader? Will that be you, Sharayla, or
It's me.
will there be others? Okay.
Yeah.
Sometimes that's important for folks to know too before they
sure.
sign up and agree to something. Yeah.
So should I put my face on the flyer at the bottom? Like contact me? Okay.
Absolutely.
I will. Add that to my baking soda in the tub list. That's a joke that everybody won't get. You weren't on the call yet. You don't, it's fine. Okay. Any other questions or comments? Oh, I love this group this morning. All my boxes are filled. This looks great. Okay. Well, with that in mind, I am going to turn it over to our presenters today. I am really, really excited about this. So as mentioned in the past, I attended a meeting and there was someone there speaking about community advisory boards and how they contributed to the science in their CTSI. And I said, well, I have to hear more about this. So she connected me to Dr. Leilani Dodgen. And she works as a research scientist at the Baylor Scott and White Health and Wellness Center. She is working there to increase diversity and health equity in research studies and programs, as well as build capacity in the organizational workforce and among community partnerships to help community needs and priorities. Her experiences have included partnering on several NIH-funded studies to ensure interventions are tailored to specific communities, utilizing a community-based participatory research approach. Her efforts are participatory in nature and often utilize qualitative methods to capture community voices and experience to drive programmatic and research directions. Currently, she serves as PI on 2 ongoing studies related to the impact of interventions on cardiovascular health outcomes and quality of life in community and clinical settings. She received her PhD in public health sciences from the University of North Texas Health Science Center and master's in public health from the University of North Carolina, Chapel Hill. She lives in the Dallas area with her husband and her 2 children. They're 3 and 6. I just added that in there. Along with us, and I meant to ask and make sure I'm pronouncing your name correctly, Brittany Ajoku.
Yes, that's correct.
Okay. And accompanying Dr. Dodgen is Brittany Ajoku. She works as a senior research technician at Baylor Scott and White Health and Wellness Center in Dallas. Her experiences include 4 years of providing support to research studies addressing chronic diseases through community-based initiatives in diverse communities with qualitative research methods. She focuses on incorporating community-engaged strategies to improve design and implementation of research studies that are responsive to unique community contexts. Her current role includes serving as a program manager for a study evaluating a comprehensive social determinants of health intervention for its impact on cardiovascular health and quality of life in a community setting. She received her Master of Public Health from the University of North Texas Health Science Center in 2021 and currently lives in the Dallas area. Leilani, Brittany, I turn it over to you, please. It's all, no more talking for me.
Hi. This is such a very warm group already. I love that we started off with talking about child interns at home and then just to hear like the journey that your CTSA is making to like reform cabs. It's so exciting. So I'm like you don't always find your people when you come and do a presentation somewhere. And so I feel like I have my people in the room. So that's really exciting. Brittany and I have been working together for the last 4 years. And prior to that, I think the person that you met that you were referring to was Dr. Kitzman. And she was I think she presented to you a few months ago, but she was my mentor, and I've been working with her for almost 15 years now, in different ways. And so what you'll see today as I start the presentation is kind of a potpourri of experiences with different community advisory boards and collaborations over a lot of different years. And what I hope that you'll get from today is just really practical ways to begin to co-learn and equip one another as you do the work together. And versus less like this will not be a theoretical like kind of presentation. So I hope it's helpful, and I really am hoping that we have a lot of time for questions. So like save them, and at the end, please let's chat some more. So let me share my screen. Can y'all see okay?
Perfect.
Great. So I want to take a moment just real quick, and these are many of the faces that have been a part of the work that we've done over so many years. And just even though I can't say all their names in one breath, I do want to at least like acknowledge the others who are not present on the call who have contributed to the work that we've done. And then as we get started, I always kind of like to define what I'm talking about when I talk about CBPR or community-based participatory research. This is kind of the definition that I always go back to, that it's a collaborative approach to research that equitably involves all partners in the research process, recognizing their unique strengths that each brings, and that it begins with the research topic of importance to the community, with the aim of combining that knowledge and action for social change, to improve health and eliminate health disparities. And so like the words that stand out here to me are combining knowledge and action for social change. That action is so important. And so while this kind of community engagement work is a continuum, like CBPR is maybe like the end of that continuum. Like we all hope to like reach that kind of equity. But recognizing that in that continuum, we are co-learning to really get to action. And then as we think about the kind of learning that we do and how we do that co-learning, this quote has resonated with me for a long time. And it says that deep learning involves the whole body, our blood and bone, not just the theoretical or cataloging of insightful facts and analyses, but deep learning moves the feet to walk in a new way, to move the eyes to see from a new perspective, won by that walking, and move the hands to fashion the tangible world into a new image envisioned by that new seeing. And so, like I said, all of the learning that is done is super experiential or participatory in a lot of ways, so that hopefully we can get to a deeper kind of learning that helps us get to that action that we want and improve health. So as you think about getting your cab started and think about how do we start to equip people, first, I like to do some reflection and think about what's your foundation? What foundation are you building on right now? So what kind of partnering or community engagement is actually happening? Our image here kind of shows us the kind of different phases or stages of partnering. It might be contractual, where you actually just have an agreement for services and you have a scope of work and you want someone to do something for you and that's it. It may be consultative, where the group just kind of comes together, you present to them, you get their feedback, and that's it. It may be more collaborative, where you really are doing the work of kind of co-learning together, but in a collaborative, most of the time that the research that is done or the questions that are being asked, or maybe even the funding that happened, oftentimes might have already happened with the university partner or the researcher already. So in that collaborative framework, you are close to that equitable relationship, but it's not yet that CAB partner necessarily leading the effort. Whereas when you get to the collegiate place, this is where your colleagues, where maybe the grant doesn't go in through you, the university partner, and instead that grant is now running through your community-based organization and they're leading the effort. I love that Sharayla already mentioned that y'all have a community member that's a co-PI. I think that's incredible. And so that means that y'all do have some of these structures in place. But just thinking about, especially as you bring new people on, defining what kind of engagement or partnering are you doing? And it may be different for every kind of project. Think about what's the purpose of that partnering, making sure that you kind of assess the strengths and the knowledge and expertise around the table. I'm so excited to hear that y'all are bringing on people that might not have research experience in the background, but thinking about what are the other kinds of expertise and lived experience that they bring. Thinking about being really specific about roles and what they do, and then that time commitment. And then other things to think about are how will you cultivate relationship and trust with one another? We talk a lot about gaining community trust when we're in community and when we're beginning to build relationship, or if we're trying to begin recruiting for a study. But with your actual partners and with your CAB, how do you cultivate relationship and trust? Because doing it there will flow out into the way that you do it as you recruit, as you engage with people, and then even as you bring on other kinds of staff. Think about your terminology. Oftentimes, different fields have the same words, but they mean very different things. And so always thinking through okay, what words are we using? And let's actually define what those things mean so we can make sure that our communication is clear. Checking to see if you have a written agreement. I'm glad that you have a charter. I think, revisiting that and seeing what else needs to be added to it. Thinking about mechanisms to handle conflict when it happens, because there will be conflict around how much people get paid for the time that they put into something. There will be conflict around IRB processes and things that you have to navigate. And so how do you handle those things? And then thinking about that compensation. I think often the money piece of things can be really undervalued on the community side. And so, but I think it's pre-COVID for sure, but especially post-COVID, this idea of what's in it for me is coming up over and over and over again as we're in community and we're talking with people about participating in different efforts. So once you've checked your foundation, then now we're going to move into kind of some scenarios. And so the way we've kind of structured the presentation is thinking through okay, here was the purpose of the thing we were doing at the time with this particular group. And so what did we do to kind of equip in each of those scenarios? So this first scenario is around the purpose of creating a program or creating a curriculum. And so we had funding that was available at the time. I was at a university, not at Baylor, but we had funding to create some kind of community program. It could be very broad. It needed to be focused on women's health, and it needed to impact or try to eliminate health disparities in some way, shape, or form around a chronic condition. So a very broad kind of purpose. And what we did was we gathered a group of women together who had a diverse backgrounds. There were a couple of university partners, but then out of those university partners, there were people who had already been implementing community health projects in community settings, and they had contacts with community health workers, lay health promoters who had run programs in their churches. We had nonprofit organizations who had been doing health programming. And so kind of with our powers combined, each of us who are at the university brought our different community contacts to the table. And we ended up with 10 to 12 people who formed kind of an action committee. So this wasn't necessarily a community advisory board, but we formed an action group so that we could actually create a program together. And so we created kind of a structure and rhythm of the way we met. We had initially, we had 6 months to create the program. The program actually took us about 8 to 9 months to actually create, but we set up a rhythm of meeting together on a monthly basis over this time. And the rhythm included, during the meetings, we would have a meal, we would have some kind of activity, and then we would debrief. And then after the meeting, there would be kind of a synthesis that happened with the university partners and the graduate research assistants that were on that team and in that meeting. And then from that, we would send out kind of either a reflection activity or some kind of task or homework assignment that wouldn't be long, but that would go to those community members or CBO partners that were at the table. And all of us would do this homework. All of us would do that reflection. And from the responses, we'd gather that in a Qualtrics, or if it was more like word-based, we would make maybe like a Wordle or something, but we would gather that information together, and that would allow us to then set the agenda and the priorities for the next meeting. And so when we got to the next meeting, we would kind of review what we had done. And when we go back into our rhythm, we'd have our meal, we'd do our activity, and we'd debrief. And this is kind of the rhythm that happened across the months. So thinking about that rhythm, this now is a picture of kind of the timeline that it took us to get to actually creating a program, which we called She Tribe. So in that rhythm, the different activities that we had per month, our first month, we thought about people shared the different experiences that they had had with health programs in the past. And then we did a SWOT analysis. So a SWOT stands for strengths, weaknesses, opportunities, and threats. And so we had flip charts across the room. Women walked around the room and wrote down, based on their experiences, having either implemented a health program in their community setting, having created a program previously, or maybe having been a participant in one of those programs. They wrote down from their perspectives, what were the strengths, what were the weaknesses, what were the opportunities, what were the threats. And that activity was used to kind of filter into what we did the next month. The next month we did a show and tell. We had women come prepared to share some kind of health thing that you learned from the program that you are still doing. It stuck. It was sticky. What was it? Why was it? Why did it stay with you? And then tell us why it's so effective and you're continuing to use it. The next month, our activity was a station rotation, where together, the month before, we had kind of brainstormed some evidence-based resources that each partner kind of knew of, or maybe it was just like promising evidence. It didn't even have to be like peer-reviewed necessarily, so much as like from the community perspective, there was something that they felt like this has been effective. People are talking about it a lot. And then we did a station rotation where we had a resource at each station, and then the graduate research assistants had come up with a worksheet for people to kind of document and analyze what was in that station. So let's say it was a resource from the American Heart Association. They had a worksheet where they were assessing what was the physical look of that material, what was the readability, what was the value for women with that particular resource. Did it give information that was actionable, that people could actually use? And then how easy was that resource to use? And there were a couple of other questions on there, but at each station, every person in that action team was kind of assessing that resource. So then that information was kind of used to get us to our fourth month, where we were really kind of analyzing and trying to figure out, okay, from these first 3 months, what is it that that we think might work for the women that are in our communities, the women that are in our lives? What kind of program are we kind of sensing? What are kind of the characteristics, the essential elements of that kind of thing? And then from there, in the 5th month, we kind of took all those priorities that had kind of bubbled up in that 4th month and created a logic model. Again, the grad research assistants were so helpful in this process. But then we deconstructed that logic model in the room during that 5th month, and our group was able to kind of write out what they thought should be in each piece of that, which led us to our 6th month, where we finally got pieces of the program, and they started actually talking through, like, okay, this is what we think should be in this session. So imagine lots of sticky notes, lots of markers, lots of talking, and it was really important to have good food as well. So that's kind of how this particular program was created. I'm going to turn it over now to Brittany to talk about our next 2 scenarios.
And so when we think about recruitment and really equipping our team, our community partners with that, this is actually from another study I'll talk about a little bit later, but we focus on using a resident advisory council for one particular study that is called the Integrated Population Health Study. And that study was designed to look at the effect of having community health worker navigation and situated within our membership or our program model at our health and wellness center. And so we wanted to create a resident advisory council to have residents from zip codes around in the area to help to inform and guide recruitment and other study activities. And so in order to develop this, we had a process where there's an application that residents could either fill out, or if they knew someone that would be a good fit to join or serve on the Resident Advisory Council, they can nominate someone. And the application had different items like, well, how long have they lived in the community? What is their involvement in the community? What are their experiences they've had, whether like education or employment, trainings or certifications, different things like that, and their interest and availability with the way they could be meeting. And following that process, there was then an interview with a few of the research team that they further talked about, like their connection with the neighborhood, some of the strengths in their neighborhood, some of the needs in their neighborhood, their collaboration, their comfortability with communicating across different audiences. So not just back to community members, but also thinking about within the RAC in the meetings that are mixed between community members and different research staff, being able to communicate information, talk about conflict when maybe things aren't seen eye to eye, and being able to effectively communicate there. And so after that interview, a total of 11 residents from different zip codes end up joining our RAC. And through the next 2 years, we met with them at a different schedule. So in year 1, we met monthly, and that's when we're really trying to establish our group. So understanding like what was the role, why are we all gathering here today? And then we moved into doing more activity-based things. And then year 2, we moved into bi-monthly meetings. And all of our meetings were in the evening to accommodate for different work schedules. And that was the time that was recommended or suggested by residents whenever they filled out their application. And so they were also compensated for every meeting that they attended. So they received a $25 check after each meeting. And then they also we had a couple of in-person meetings. This was during COVID, so we mostly met virtual, but we had one that was in person, and we had like a family style meal where we all ate together and then went over our agenda. And so whenever we did meet, we always had some sort of agenda, had like an icebreaker question. So we weren't even getting into the details of what we're there for, but something like, how was your summer? Or what is your like a holiday tradition? And then we moved into talking about whatever was the topic at hand. And so there was a guided discussion about different things depending on where we were. So we started out talking about neighborhoods, there are different communities, and then we moved into talking about some of the things that are important or effective in working in communities. And then we moved into talking about research, the study, recruitment. And so sometimes it would be the research team posing questions to community members or our RAC members, and sometimes it'd be our RAC members posing questions to us. So to really help to provide that environment for there to be co-learning to happen. And in addition to that, we also wanted to make sure that it wasn't just the research team creating everything, but it was a co-creation of different documents that would be used. So there were resource lists that we created together. There were different materials that went out to community members when we talked about promoting the study that our RAC just helped to design and gave feedback on things that would work or things that would not resonate with community members. And the last strategy that we really focused on is making sure that we translated all of our ideas actually into action. So we didn't want just suggestions from the Resident Advisory Council and they were never acted upon. And so we worked with our IRB to do different things. For example, our recruitment flyers are usually just like a PDF that we have, but our RAC members talked about how it would be really helpful to be able to share it like as an image or share it on like social media. And so we worked with our IRB in order to have it in another form that was easily shared. We also heard a lot from our RAC about different challenges that community members faced whenever they thought about the study. And so we were able to bring additional resources like partnering with an organization that offers transportation. So that would be a barrier we can address so they could still participate in the study. And then we also acknowledge that though we brought all of these community partner or all of these residents together from different organizations, their communities were very different. So we had a lot of one-on-one meetings outside of our regular meetings in order to address some of those unique things in their communities and maybe some unique strategies and thinking about what resources, either if it was different documents or if it was time from our different research staff, how we can assist with those unique strategies in their community that they were leading. And so so moving from our Resident Advisory Council, that was all about recruitment. This picture is kind of hard to see, but this is for another project that we were working on. That is a partnership with a local community-based organization to provide health programming. And this is the one that we're evaluating the impact on cardiovascular health and quality of life. And so we're actually, there's one of our community partners, he's over on the left side and I'm in the middle, but we were co-facilitating something here. And so another scenario we want to talk about is how to equip our community partners or community members with co-facilitating or collecting data of however you plan to do it. And so for this particular study, we identified a core group. So within our community partner, there were different staff members. Some had been with the organization for a long time, others that actually lived in the community, and they were also staff, and some of them were volunteers. So a few people that could represent our community partner that would work in hand with the research team. And so to start off our partnerships, very similar to what Leilani talked about earlier, is really spending time to learn about the expertise of each different group and learning about their values, learning about the history. And so we had different things like we walked the neighborhood with Bonton Farm staff. That's our community partner. So we walked the neighborhood with them. We went on mission walks where it was really focused on like the history and the context. There were different resources that they shared with us, such as like documentaries that had been focusing on the neighborhood or different articles to gain that context. But we also learned a lot through informal conversation. So sometimes it wasn't we're training for an hour on community engagement, but just through conversations before meetings, after meetings, during class, where they talked about the history or how things had changed over time that were really important for our team to see, the community we're working with, because every community is very unique. And so when we worked with our IRB, it was a lot of advocating for things that were very different than what our IRB was used to. And so they would say no, and then we'd come back to them and we're like, well, we have to figure something out. And so a couple things that I want to highlight are we added a few of the staff members from Bonton Farms that were working really closely with recruitment and co-facilitating to the IRB as a non-key study personnel. And so usually our IRB requires city training. And if you've gone through city training, you know it is very cumbersome and it's very complicated. And so we we're thinking about like, what can we possibly do? And we found a community version of City Training. It covers the same topics called certification. And it was presented as a 4-hour workshop that a couple people from the research team facilitated the content, but it is designed to be very to be modified for the community context. So it provides different scenarios in there, in the directions like ask questions or provide scenarios that are related to things that actually happen in the community. And so that was one of the places that we learned a lot too, is they'll present different scenarios. For example, they talked about compensation, and that led into a whole conversation about how our standard practices at Baylor required participants to give their social security number in order to get a gift card from Baylor as part of a W-9 they had to fill out. And they shared with us, they're not going to sign it. Like, I would barely sign it. I know you, and I don't even want to give you that information. And so we went back to our IRB. We're thinking, like, what can we do to overcome this? Because we need to compensate anyone who participates in different activities. And so we ended up finding another process. We were able to reallocate funding to Bonton Farms, and then we're able to provide a gift card that did not require a social security card. And so it was really important for us to be able to advocate for our community members to do things that are more in alignment with their community. And so we were able to add our partners onto our IRB, so they were able to help us help to collect data. And so it was a partnership in terms of where they helped to create the focus group guide. We actually framed them as community discussions to be more, there are some really technical terms that are used in research often, and we wanted to remove that barrier, especially because some of the historical context that we heard about. And so we framed them as community discussions. Our community partner developed some of the questions with us, our surveys, and developed the questions. It helped us assess it for literacy, making sure questions were appropriate for our community. And we facilitated training on conducting community discussions, how to do qualitative research, an intro to qualitative research, and they were able to facilitate 3 of 5 discussions with us. And then we also did these listening sessions. They also co-facilitated with us, and that was a way for us to return back to community members that have participated in community discussions and share the information that we learned. And the last thing I want to highlight is canvassing was a really big part of how we promoted the community discussions. And that was led by our community partner. We partnered in like small groups, 2 to 3, and we just walked through the neighborhood to get to know community members. They introduced us to the community members that they already had contacts with. And we started to build that relationship. And that's how we engage people with the community discussions.
So our next scenario is talking through getting to present or disseminate your work together. And the study that this is from, it was called Better Me Within. This was a faith-based diabetes prevention program that was implemented in churches throughout the southern part of Dallas. But the diabetes prevention program is a national program. It does not have its own faith piece. But we had worked with our community advisory board, who were made up of pastors and first ladies from different churches, to actually do focus groups and create a faith component for that curriculum. So when it came time to actually disseminate that work, the community advisory board was thrilled to get to have the opportunity to brag about the work that they had done and to have a voice in a space where they don't typically have a voice. And so we prepared for a presentation in a similar way that we would prepare for a presentation on our own, except it took longer because we were planning it together. So we brainstormed the topic together, and then we identified who wants to do what. So our community advisory board was made up of pastors. So obviously they're great speakers and good writers, but they wanted those of us on the university team, you make the slides, you put the content together, and then we'll edit it. And then don't worry about us speaking, like we'll be able to speak, no problem. And so we drafted an abstract, the CAB edited it. Once it was accepted, then we did the same thing with the presentation. We drafted kind of the content of the presentation, they edited it, and then literally at the conference, we, a few hours ahead of our slot to talk, we were circling up together and chatting and laughing, and they were going through the presentation and we're ready to go. And I think something that was really important to them during this process was being able just to offer their perspective of the value of partnering together. The presentation that we did for this group was talking about partnership processes and how partnerships can work when you are when you're trying to do community engaged work together. And so they had distilled down kind of these nuggets of tips and information that they thought were vital for other people to know if they were a community partner and wanted to partner with the university. And so it was a great presentation. They got a standing ovation, and it was that there were tons of questions that people wanted to ask them afterwards. Our next scenario is around evaluation and improvement. And I think sometimes often we miss an opportunity to actually evaluate our partnership with our CABs and advisory boards. This is one activity we used in the project that Brittany was talking about with IPOP, with our Resident Advisory Council. We had an intern that was with us, and she helped us to find different participatory ways of evaluating partnership. And so we did this activity called a River of Life. And what it does is it has you think about kind of the past, like before you joined your partnership, what was kind of happening in your life, what drew you to actually coming to partner together in some way. And then we had questions to facilitate, what were the successes that we've had during our partnership. So here in this image, these green sticky notes are the successes that these partners thought that we had, that there had been community insights and ahas, that we were able to work together as a group, even though we were in the middle of COVID. And so you can see challenges we faced were COVID, virtual meetings, technology. This group of Resident Advisory Council members, many of them were over the age of 50. And so, but we're dedicated to figuring out how to use technology. They had helpers to help them be present and be on screen, be on camera. We talked about facilitators to the partnership, things like having recruitment events and how they were able to pass out flyers through different organization events. We talked about fostering coordination, this being able to utilize technology in a new way. We had never put a QR code on a flyer before this point. And then we talked about the future. Those are those light blue notes here. And so this was an interactive way of kind of assessing in a qualitative fashion our partnership. This was also followed up by an actual survey of partnering questions that was developed by Nina Wallerstein at the University of New Mexico as well. And so those two things combined, we got a full picture of kind of being able to evaluate that partnership and think about ways that we could continue to equip one another to learn how to improve and how to grow. And so some common helps as we distill kind of all these scenarios are having someone, whether it's on the community side or the university or organizational side, to manage your communication, to document your meeting minutes and document decisions that are made. That person is an invaluable part of any kind of collaborative work. The other thing is having kind of activities and things that are interactive that don't rely on just one set of expertise. So being able to have kind of these facilitated activities where everyone's knowledge is being gathered and everyone's input is documented, and you don't have to have had like preparation ahead of time necessarily, but you're drawing on the knowledge that you have within you and are being able to express that. And then allotting time, I mean, time is always a thing, right? When we talk about these community engaged or CBPR kind of projects, that's one of the biggest critiques is time, but we can plan for it. We can absolutely plan for it. And so I think allotting a minimum amount of time of at least twice as long as you think to accomplish something is really important. Having flexibility in your timelines, and then also being able to communicate with your community partners, like when you have to move forward, because sometimes that's a necessity too. We have to be able to say like, okay, like we're not going to get this 100% right this time, but we're going to have to move forward, and let's document like what we want to do different the next time we come up to this scenario. So other ways to equip one another that we didn't really touch on is joining together in that grant planning process, having them at the table, showing them the RFA, getting them to brainstorm through it, walking through the terminology, the requirements, and those pieces. Also, things like going to each other's organizational meetings and conferences. Our current project at Bonton Farms, we're attending their neighborhood association meetings. They're coming to our events that we have at our center in our community, and so we're doing an exchange that way. But also in past projects, we've had community advisory board members who come to our data safety monitoring meetings, who come when we have an IRB audit, who come into our classroom. And so just an idea of being present and sharing your networks with one another is another way to equip and learn that is a kind of more passive and not direct. So we'll exit out of the presentation here, and I'll share these slides with Sharayla, but I want to get to questions from y'all and be able to keep moving forward.
Thank you so much for this. There's so much in the presentation. As mentioned, this is recorded. It will be on YouTube for people to watch, and thank you for including the slides. My first question, I have several, but I have your email address, so I might just email you on the side and let other people ask. But when you decided to meet in person during COVID, how did you choose your locations?
Yeah. So we had some, at that time we were at Baylor, and so we had some mandates required that the hospital system had put out around what was okay and what was kind of the minimum standard. So I remember like having a ruler and like measuring out how far each chair could be from each other, and letting people know about masking, but having masks, and everyone got their own bottle of hand sanitizer. And that eating that happened, we were even more spread apart if we did choose to eat together, but most people didn't. And so, but we just kind of followed the minimum standards that the hospital had put forth. But then we also had asked our community partners, like, what are you comfortable with? And they had told us in advance, kind of, these are, we like this, we don't like this. But I will say that was the meeting that we had the lowest participation. I think people kind of wanted to meet, and then it came time to meet, and then they were scared to meet. And so after that, the virtual we just said, okay, we're not going to do in person anymore. We're going to stick with virtual. We have higher attendance. People feel really good and they're participating well. So that's how we handled that.
I have a question for both of you. Thank you so much for an amazing presentation. I'm curious if you could speak to this question of having community members find the work we do to be relevant to their lives. I know this is kind of philosophical, but I think one thing we're talking about in our MARG meetings is I think sometimes community members just frankly don't have time, even though we are there for them. They just have other issues they have to deal with. And so I just want to be really real about this. Like, how do you make it relevant for community?
That's such a good question. I think it really depends upon the purpose of the project. And I think, the one that we're doing right now in Bonton Farms is located in kind of a historically marginalized neighborhood. And we've had the grant funding for about 2 years, but getting to that was like 5 or 6 years in the making. And so there were conversations after conversations about, okay, how can we make this relevant? What is going to be helpful to the community? And then even, it took 5 or 6 years to finally get to a point where we did partner and get funding to do something. But even then, once we got there, we spent time doing those community discussions and listening sessions, because even at that point, what had been proposed needed to be changed based on actual community member feedback. And so it is fluid and ongoing. I think one of the ahas when we did the community discussion was, hey, y'all, like you said, our priorities are not their priorities. And so the avenue that we need to come from is their priority. So their priority is having an activity for their kids. Okay, we need to make sure that kids can come to this activity, and then we're going to put our thing with it. And, or we are going to, for example, we were planning to do health screenings in the community, but the feedback around fear of being stuck, like having a finger prick, or worry around like, well, what if I do figure out that I have diabetes, then what do I do then? And just like the amped up anxiety of even just before you even get to a finger stick, like what is present there. So we took health screening off the table as a service that we would provide. And instead, once people got into our programming, after a while, we then start talking about, okay, like we've been talking about health. There's some ways that we can monitor that. And so doing like a slower, we called it like a dating process. Like you would never like start dating someone and be like, okay, let's get married tomorrow. I mean, some people have, right? But usually you don't. Usually it's a little more gradual. And so we were like, okay, well, coming into the community in this way and just saying, okay, we're going to start with a finger prick is like jumping to marriage when we haven't even really gotten to know each other well. So instead, let's flip. Let's start with our programming first. Let's get to know our community members. Let's do the cooking classes. Let's invite them to things so that they can know us a little better, and then say, hey, you know what? There's actually a way that we can begin to monitor this, and we can do that by introducing health screenings.
So this is Dola. I have a comment, one about the 5 years before the project start. Usually when we engage with communities, there is a grant with a 5-year time frame, and we got to get it done, and there's not the space for building relationships, and then there's not the money to continue the work or the relationships after the grant. So I just wanted to maybe just make a comment about that and see what input you may have. But then my other question was, we get stuck with MOUs between partner organizations and the university. Like there's so much red tape, what to do, what to say, how to do it, and all the things. And so I just wonder what your experience was with that as well.
Yeah. So in terms of like the relationship piece ahead of time, I mean, because that relationship was being cultivated from an organizational level, it was more like, okay, we're just going to keep going to meetings. We're going to keep talking about this thing on the side. And we're going to keep looking for the right opportunity for that thing to happen. And so I think it was a priority to figure out how to get something in that community. And so that's why that 5 years of looking on the front end continued to happen. But it wasn't a lot of, it was like a quarterly meeting, a phone call here and there, going down there to have lunch every once in a while. And it was also different people than me. So that was a whole different batch of individuals that kind of had done that groundwork. And then I came in at the point where we had funding. And so then we had to do a whole new relational thing then too. So I think, it's still messy and complicated, and still takes a lot of communication, but that's kind of what that looked like. And then for your question about MOUs, it's a ton of red tape and not fun at all. One of the things that we have found success in is in relying on other community organizations' MOUs that they already have in place, and being able for those organizations to add an amendment or add a line where we can participate we can participate under their organization's MOU, and so we're covered. Versus it being between our organization and that particular organization.
Thank you for that.
Yes, I see your hand, Hope.
So that was a brilliant comment about you coming in within another organization's MOU that you have a relationship with. So thank you for that insight. I think this was such a great presentation and so many things that I think we've all learned from. One of the things that I continue to think about here is we have patient research advocates, which are individuals that have experienced the disease and have a collective experience with that disease, as well as our community advisory board. So we really have two different groups, setting the stage, and sometimes they cross over. Our community advisory board for the Cancer Center is focused on kind of big picture strategic. They help us select community grants. They help us identify where to do cancer screenings, et cetera. And they're and we try to create a kind of this bi-directional relationship with them. I guess as I saw that river that you created, which seemed like a really great way to begin evaluation with some of the surveys. Is that kind of the guidance you would give then as far as evaluation, or do you think it looks different if it's not specifically tied to a specific research project?
I mean, it does depend on your relationship, but I feel like you can broaden that river. The topic doesn't have to be the project. The topic can just be our relationship as an advisory board and our institution, and talk about, how did everyone get here and what have we done so far together? And then where do we want to go? And I think it can be utilized as a way for you, especially since that group that you're talking about, the Cancer Center, is big picture. It can help you think about, okay, how do we want to be strategic about planning for the future work that we do? Because often there's all of these sexy things that start to pop up and get funded, right? And so, but it's like, what is important for our center? What is important for our state, our community? Where do we need to focus our eyes on? And so I feel like an activity like that can help you to kind of filter through the other bells and whistles that are kind of clamoring for your attention, and help you to get a strategic vision for where you want to go with that partnership, or maybe even where you want to go with your funding priorities.
Yeah, that's really helpful, because the last thing we want is to pull people together so that we've checked a box, right?
Totally. Absolutely.
So that's the challenge of it. The agendas can be driven by the Cancer Center when it really needs to be driven by even the meeting agendas by the community members. So.
Totally. Well, and I'll share when I send the slides to Sharayla, there's some actual quantitative questions that come from a survey. So I'll share those too. We had an intern adapt them for us based on our needs for our advisory board, and then she implemented it through a Qualtrics survey so that their feedback on the quantitative side was anonymous. And we got some really honest feedback about some concerns that people had around transparency, sustainability of the work that we were doing. And those things were really helpful for us to be able to talk about together.
Thank you. That is excellent. I am sorry I have to jump off for my next meeting.
No, it's okay. Thank you so much for y'all's time. This was great.
Thank you, everyone, for your participation. I appreciate you Brittany and Leilani, this has been really eye-opening for all of us. I plan to watch the YouTube video back, fast forwarding through a couple of parts and like really drilling down and getting some of that deep learning you were talking about. I want to respect everyone's time, especially our guests. So if there are any announcements, feel free to either drop them in the chat or you can email them to me and I will disperse them to everyone in the email once the video is uploaded to YouTube. So thank you all. I just want to mention, you know, while we have this too, everyone that's in the Kansas City area, there are counseling services available if you feel traumatized by the events that happened yesterday, as some people are feeling those effects right now. So please don't suffer in silence. There are plenty of tools that we have available through KU and through your other partner institutions as well. But if you do need help finding something, please reach out to me. Do not suffer in silence. Okay. Thanks, everybody. We'll see you next month.
Bye. Thank you, everyone.
Thank you, Sharayla. Excellent.
Bye, y'all.